Okay. The Salter-Harris classification generally has got 5 types. So you see here the type 1 and type 2 actually heal well, whereas the type 3 can actually develop the arthritic changes or asymmetric growth plate fusion. Because you see here in type 3, because there will be an epiphysis and the growth plate actually has got the problems. So since the epiphysis is involved, so there will be asymmetric growth plate fusion that is seen in type 3. And type 4 and type 5 are more likely to develop early fusion of the growth plate, and they are more likely to cause the angular deformities. And there will be seen along with a shortening of that bone, because in the type 4 and type 5 there will be a little bit of a compression in the type 5 and in type 4, whereas the three parts, the epiphysis, the metaphysis, and the growth plate are separated. So there will be shortening of the length of the bone along with angular deformities. So in type 4, generally there will be angular deformities, and in type 5, there will be generally the shortening of that bone, right? So we can actually see that one thing, that the Salter-Harris fractures are involved down on the basis of the epiphyseal plate or the growth plate. So type 1 fractures are generally difficult to detect without the opposite side. So you actually need the opposite side or the contralateral side for the comparison of the symmetry. Okay, but however, they have the best prognosis. Okay, so best example you can actually say is that there is a slipped capital femoral epiphysis, okay, which is also known as SCFE, which is a best example that is related down to Salter-Harris type 1. Okay, capital, okay, acetabulum or the head, okay, femoral head epiphyseal fractures are most commonly seen along with the type 1 Salter-Harris type. Okay, then you can see here the actually the slipped SCFE or the slipped capital femoral epiphysis fractures actually occurs often in taller and heavier teenage boys. Okay, uh, it can actually occur during periods of rapid growth from a trauma, which is related down to the you know falling. Okay, and then it can be also related down to osteodystrophy of the kidneys, okay, which is called as the renal osteodystrophy, where the calcium metabolism is responsible for that, and then also can be related down to the endocrine thyroid disorder, which is also controlling the calcium levels of the body. So Salter-Harris type 1 causes slipped capital femoral epiphysis fractures, which is seen mostly in the heavier teenage boys during the rapid growth period. Okay, so what happens is that in the Salter-Harris type 1, that the epiphysis is separated from the growth plate, right? So actually epiphysis slips inferiorly and medially and posteriorly relative to the neck of the femur. So it is mostly bilateral, okay, and then also can result in avascular necrosis, where there will be a vascular compromise. Because you have to understand one thing here, most of the times avascular necrosis is a problem that is related down to the vascular supply to the epiphysis, right? You have to understand that most of the times that the epiphysis acquires its blood supply from the proximal to the distal regions, right? You can actually understand, sorry, distal to the proximal regions, because the main arterial supply to the bone will be present down in the diaphysis, which is present distally. And then Again, the same way in the proximal end, the femoral head is present down in the proximal end. So the nutrient artery that is present distally will be supplying the blood. Okay. Well, you see here, no. Actually, the one they are talking about, yes, if it is bilateral in 25% of the cases, right? But generally, you see here the presence of separation of the epiphyseal plate, which is seen on the both sides, okay, on the right side and on the left side. Generally, actually, let us say one side has got more slippage and one side did not even start to have the angulations yet. So in such kind of a situation, comparing the symmetry is going to help which one actually to be intervened first, right? So which means to say, let us say the right side has got already in a phase of a vascular necrosis when compared to the left side. So which one has to be intervened first? Yes, the right side has to be intervened first, right? So actually the comparison will be done onto the contralateral side. Well, it actually depends. It is generally if it SCFE is the best example, but most of the times it can be also related down. If it is related down to the endocrine problems, yes, most of the epiphyseal plates of all the long tubular bones will also be involved, right? So either you, when you are suspecting that if it is related down to the endocrine problems and if it is shown up on the femoral head, you are going to confirm the endocrine problems related to thyroid or hypothyroid conditions also on carpal bones as well, right? Last time we came to understand that the ossification centers appears at different times. But by the time of age beyond 10 years, all the bones should have formed, right? And the same way you actually try to understand here, I said avascular necrosis is most commonly seen in femoral head, but there is also another bone which there is an avascular necrosis that is actually seen very commonly. It is the scaphoid, the carpal bone, okay? Scaphoid carpal bones, okay? Carpal bone also has got also can have a vascular necrosis. Okay, remember, so that's the reason we can actually, when you are trying to understand the endocrine related problems, you can also see that there might be some kind of an evidence that might be related down in some other structures or some other joints also, okay, or some other bones as well. So in such kind of a situation, when in doubt, we are actually going to try to compare it to another region and try to confirm the situation if it is bilateral, because you see here, unilateral things are generally happening because of trauma, but bilateral things are generally happening because of endocrine related problems. So that's how we are actually trying to find out the evidence. Okay, right. And then we can also see that the blood supply is actually in 15% of the cases is actually compromised. So which is the reason for avascular necrosis. So remember, avascular necrosis generally happens in teenage boys, okay, and it is related to the blood compromise supplied by the nutrient artery towards the epiphyseal plate, okay. And but I think last time I told you, if there is an avascular necrosis that is happening down in adults, it might be related down to a clinical condition of alcoholism, alcohol abuse, and acute pancreatitis. Okay. In adults, if avascular necrosis is happening, it is actually happening because of alcohol abuse and pancreatitis. It can also be related down to endocrine related problems such as hypothyroidism. All right. Okay. Now you see here, this is a slipped capital femoral epiphysis. You can actually see here on the right side that the epiphysis where the femoral head is securely projected down into the acetabulum is completely slipped, which is actually showing up the metaphysis and the diaphysis of the right side is displaced superiorly, right? So In such kind of a situation, you can actually call it as the epiphyseal displacement, a complete separation of the epiphysis, which actually suggests that this is a type 1 Salter-Harris type. Okay, and then you can actually see here there is a superior displacement where a line drawn to the parallel to the neck of the femur is actually present above, okay, which is superiorly displaced when compared onto the left side, which is securely present, right? So this is actually called as the Kleene line. Okay, so now what actually happens, it should actually, the lateral portion of the head should be actually intersecting, okay, when a line drawn to the neck of the femur should actually intersect the lateral portion of the head, because the hip joint is present down as a straight line. But now here we cannot see here, and you can see that line is displaced superiorly. So by this we can actually understand that there is a displacement as well, okay, and which actually causes the shortening of the length on the right side. Okay, so how can we actually confirm this one? We can actually also confirm this one clinically by doing a Trendelenburg's test as well, right? Okay, last time when I showed you what, because this displacement is actually happening by the adductors. You see here, sorry, abductors. It is actually, you can see here, there is, when compared to the left side, there is an angulation that is present down laterally and superiorly. So what are the muscles that actually cause such kind of movement here? Okay, it is the quadriceps and the gluteus muscles that actually pull down the adduct. There will be abduction, okay, it will be moved laterally and it will be moved superiorly. So there is a hip joint flexion, okay, medial grade hip joint flexion along with the abduction. Okay, it's not adduction. Adduction is moving close to the body, but you see here there is a lateral displacement. So that's the reason. What we actually do is try to understand that there is a superior flexion and along with the lateral adduction. So lateral abduction is seen, and so here there is an elevation of this Kleene line, where the Kleene line is present down as a straight line where the head of the femur is intersecting with the lateral portion of the head. Okay, so that one along the neck is in a straight line with the femoral head, so that is actually called as a Kleene line. But on the right side I can see the elevation of the Kleene line. So that is how I came to understand that there is a separation of the epiphysis of the femoral head on the right side. Okay, is this point clear? Yes. Which part didn't you understand, Aman? See, there is nothing related down to the fracture part. How do you recognize the fracture here? The fracture is recognized down as the radiolucent line. Yes, first thing. But still, this is a young patient. Okay, so obviously we can see that there will be no joining of the epiphyseal plate to the metaphysis. Okay, so, and how do you actually recognize it as the Salter-Harris type 1? There will be a separation of the epiphysis from the epiphyseal plate and the metaphysis, right? So you can see here that one. The acetabulum is securely positioning the femoral head, but the fusion did not happen. So that's the reason there is a slippage of the metaphysis and the diaphyseal part from the epiphyseal plate. So that's the reason I call it as Salter-Harris type 1. Yes, is it clear now, Aman? Right, so that's how it is. Okay, now Next, Salter type 2, where the epiphyseal plate, okay, fracture of the epiphyseal plate will be there, and also the fracture of the metaphysis as well. Okay, and this is the most common type, and generally healing is very rapid because you see here it's only a small segment of the metaphysis that is actually being broken. So maximum part of the epiphyseal plate is already included in the attachment itself. So generally it is uh, rarely distributed. Okay, the growth is actually, you know, very rarely disturbed. And then what actually happens generally, if it is happening in the distal femur or the proximal tibia, understand here one thing, these are actually happening along the articular surfaces. So whenever you are trying to look at the Salter Harris types, when you are trying to identify, you have to identify the distal and the proximal bones. Okay, if it is generally presented down on the distal side of the femur, and the articular surface is actually happening with the proximal part of the tibia, so that's the reason you have to look at the epiphysis of these both bones. Okay, so generally which will actually cause a residual deformity. Okay, residual deformity will be present, okay, in type 2. So what actually happens is that the small metaphyseal fracture fragment is actually producing called as the corner sign. So maximum part of the epiphyseal plate is involved, and only a little part of the epiphyseal plate, okay, along with the metaphysis is also uh, uh, turned down. So only a little part of the epiphysis is actually secured. Let us try to understand this one here. You can see here this radiolucent line actually represents that this is the epiphyseal growth plate, right? You see here there is a complete separation. Okay, there is a complete separation of the epiphyseal plate from the metaphysis, and you can also see here on the lateral side of the thumb, you can actually see that there is a small bony fragment that is actually shown up as the metaphyseal part. So, growth plate fracture along with a small part of the metaphysis is actually representing the corner sign and also suggesting the Salter Harris type 2 fracture. Okay, is this point clear? There is a bony fragment that is present as a part of the metaphysis in the corner. So that's the reason we call it as the corner sign. So corner sign is seen in Salter Harris type 2. How can I recognize it? The fracture of the growth plate along with the smaller part of the metaphysis. Okay. No, you see here when compared to the other regions. See, when you compare to the other epiphyseal plates, you see here they are almost securely present, where the provisional zone of calcification is quite seen here. You see here there is a very thick hyperdensity line, you know. So that's the reason which actually says that the provisional zone of calcification and the zone of ossifications are actively involved, but I don't see such kind of signs here in this end. So that's the reason why I call it as a fracture. See, when actually it is joining together, when a growing tubular bone is actually coming together, finally all the bones should be forming out a single structure. Yes or no? Yes, Benedict, is this point clear? Finally, when the ossifications are complete, what actually happens? All the long bones should be forming out as a single segment. Okay, be it a humerus where it has got something around like uh, 6 parts before the ossification will be taken down as the sorry, it will be having 5 parts before the ossification. When the ossifications are actually complete, it actually forms a single long tubular bone. The same way here also. Okay, the same way here also in the metacarpals, they are long bones as well, but still they should be fused to form as a single segment. So what actually it forms down as a single segment in when compared to the other bones, what actually happens is what actually happens is that they should be actually showing up as a provisional zone of calcification along with zone of ossification securely attached to each other. So which is actually showing up, there is no discontinuity in the cortex, at least along the epiphyseal plate, right? So that is why we actually call it as the fracture. Yes, Benedict, is this point clear? Right? Did you understand why we actually call it as the fracture? Yes, they should be actually forming down as the long tubular bone, but they are not forming down as the long tubular bone. So there is a separation of the epiphyseal plate, and the provisional zone of calcification and the zone of ossifications are technically compromised here, along with the breakage of the metaphysis part. So that's the reason it is actually called as the corner sign, right? Okay. Okay, let's see the next types. Okay. Then type 3 fractures, actually this is a longitudinal fracture. Okay, longitudinal fracture actually happens that there is a part of uh, the epiphysis that is actually involved, which is actually happening down as a secondary long-term implication to the secondary osteoarthritis, and it can actually uh, what actually happens is that there is an asymmetric and the premature fusion of the growth plates. Okay, there is the asymmetric and premature fusion of the growth plates. So what actually happens that there is a subsequent deformity of the bone, and the treatment actually requires the recognition for accurate reduction. You have to understand one thing here. In the type 3 type of fractures, what actually happens is that the epiphyseal plate and the epiphysis are involved. So generally, if the epiphysis is gone, if the epiphysis is actually taken away, what actually happens that there will be influence on the articular surface. So that's the one, it is actually causing the subsequent deformity. First thing to notice here, and there will be an asymmetric and premature fusion of the thing. Premature fusion will be happening because you see here all the part of the epiphysis was separate, and a little part is actually fused together, so which is actually causes the premature fusion. So that one will lead to asymmetry, will actually lead to subsequent deformity, and premature fusion will actually lead down to osteoarthritis conditions. So both of them are actually causing as a combined feature together in type 3 type of Salter-Harris type 3 fractures. You can see here, this is the provisional zone of calcification and this is the epiphyseal plate. And you can see here, this is again the distal phalanx. Okay, the distal phalanx, actually you see here, this is the great toe. We are talking about the great toe here. Okay, and you see here along the proximal epiphysis. Okay, the proximal epiphysis has been separated. So this one, the growth plate, there is a fracture line that is present down as a radiolucent sign, which is actually suggesting that there is a fracture line of the epiphyseal plate here, and there is a oblique fracture that is related down to the oblique fracture that is related down to the epiphysis, proximal epiphysis of the distal phalanx. Okay, so that's why we call it as Salter-Harris type 3 fractures. Okay, so that is the description of this one. You see here, there is a longitudinal fracture to the epiphysis here, this one. Okay, and then there is a longitudinal fracture also. So all the things together, we call it as Salter-Harris type 3. Okay, then type 4 generally has the poorer prognosis. Okay, they are premature, possibly asymmetric closure of the epiphyseal plate. Okay, asymmetric closure or the premature closure of the epiphyseal plate, whereas the Salter-Harris is again the fusion of the growth plate and asymmetric as well. But what is the difference from the type 3 and type 4? All the epiphysis, metaphysis, and the epiphyseal plate, all the three components are involved together, right? So generally they happen down in the lower extremity, where they actually result in the differences in the length, angular deformities, and secondary osteoarthritis as well. So that is how they are coming together. So let's try to understand what exactly he meant by this. See here, when you actually look at the distal end of the tibia, you see here, this is the metaphysis, this is the growth plate, and this is the epiphysis. And you see here a smaller part of the metaphysis is involved. The growth plate and the epiphysis are completely separated. So there is a corner sign as well, and there is an epiphyseal dislocation as well. So all of them together will actually, you see here, we are talking about the medial malleolus. So the medial malleolus has actually trying to form, it is forming the angulation, the correct support of the ankle joint on the medial side. Okay, so now when it is not there, actually you are going to see that there is a lot of deformity along the ankle joint. So there will be walking difficulty, and you see here, since the epiphysis, the articular end is also involved and it is broken down, there will be inflammation that is seen along this part of the joint as well. So we can actually call it as osteoarthritis, since the articular ends are involved. So that's the reason we can also call it as osteoarthritis, but it is happening because of a fracture, and it is Salter Harris type 4 along the articular end, so we call it as secondary osteoarthritis. Now right now you see here, this one has got its own growth plate, this part has got its own growth plate, so this one will grow separately, this one will try to fuse separately. Now what happens? This part will completely get filled up here, so there will be a permanent angular deformity. Yes. So if right now they are trying to close, you see here immediately after 11 days, what actually happens? Even all these fractured parts are also going to get fused, right? So this will be permanently fused in this deformed angle itself. So which will be actually causing a permanent asymmetry and a permanent deformity of that joint as well. Did you understand this point? So that's the reason they are called as the poor prognosis. Yes, is this point clear? Yes or no? Right? Okay. So it's quite easy. How we can recognize there is a corner sign because of the metaphysis involved. Okay. And then you can see here, and the epiphyseal plate is also involved, and then you see here, this is the epiphysis. So articular surface is involved, epiphyseal plate is involved, and the metaphysis corner is involved. So that's the reason we actually call it as the Salter Harris type 4. All right. Okay. Then Salter Harris type 5, which is actually called as the crush of the epiphyseal plate. So this is the Salter Harris type 5, where there will be compression or the crush fracture that is related down to the epiphyseal plate. This is also associated with the vascular injury and will also result in the growth impairment. So since the vascular injury is present, so all the nutrients that has to be supplied for the provisional zone of calcification and the zone of ossification are eventually lost, and what actually happens that there will be a delayed closure of this plate. Sorry, the early fusion will happen, and then what actually happens is that there will be a growth impairment because it will not be fused completely. Okay, so focal fusion will be happening, so we call it as, rather than uh, early fusion, we can actually call it as early focal fusion. So now what actually we can see here, it is present down in the most of the distal femur or along the proximal tibia and the distal tibia as well. Then they are generally difficult to diagnose on a conventional radiograph, because unless and until they are completely ossified, okay, Ossification is entirely different from fusion. Okay, fusion is joining together. Ossification is completely forming down the tubular bone as a single structure. Okay, so this one is in the early stages, fusion is in the early stages, but a complete joining or the complete ossification is in the later stages. So they are difficult to diagnose on the conventional radiographs. So how can we see? Let's try to understand here one thing. What should be present? There will be impaction of the growth plates within each other, right? So there is this is the distal radius, okay? Then what we actually see here, that the fracture line is actually not particularly seen well. You can sometimes misunderstand this one as the complete fusion, but when you look close enough you can actually see here that there is a hyperlucent line that is present. And how can I know that this person has not been fused yet when I compare to the other bones? Okay, the ulna that is present down close to its proximity is actually the one that is actually showing up as a complete epiphyseal plate that is intact, you see here. But when compared to this structure, you can see here in the lateral side, in the medial side, you can actually see that there is a lot of fusion, which is actually suggesting that there is an impaction of this part. And then you can see here there is a hyperlucent line that is present on the lateral side. So this one is actually the one that is the normal plate here, and this is the impacted area of the epiphyseal plate. So generally what actually happens is that which results in the change of the articular surface. So where these ends are actually trying to fuse with the carpal bones is actually going to change in it, which is forming an angulation, okay, angulation of the radius. So there will be an angulation that is present along the wrist joint. So and now if this one is fused completely, so that's the reason they will be early fused and they will be permanently fused off like this, because the zone of calcification is completely competing with the zone of ossification. So what actually happens, so there will be complete ossification at an early stage itself, and finally it will be settled down in this form, uh, in this deformed part as like that itself. So that's the reason you can actually see that there is an angular deformity of the wrist joint. Okay, so since there is a vascular compromise to this place, so that's the reason. Can you tell me actually what is the blood vessel and what is the nerve that is actually involved here? Last time we didn't deal about the carpal tunnel, but what is the nerve that is actually involved here? What is the nerve that actually does not form the carpal tunnel? What is the nerve that is not included down in the carpal tunnel? No, it is involved. Median nerve is involved in the carpal tunnel. I asked what is the nerve that is not involved. Ulnar nerve is not involved, right? So now here, what when we see, we can actually see that there will be a median nerve problem as well, right? Okay, but also you can also see that there will be ulnar nerve entrapment also because of the angular deformity. So did you understand now what is the difference? The nerve that is not involved in the carpal tunnel is the ulnar nerve, and you can actually see that the median nerve is also involving down within the carpal tunnel. So if there is an entrapment of the median nerve and the ulnar nerve, so both of the complications can have, right? Okay, that is what I particularly wanted to say here. Get it? Okay, so that is about this Salter Harris type 5. Then We are trying to understand one particular things here. We have to understand this is a very, very serious situation. But maybe along the, as the undergraduate physicians, we generally will not be dealing about such kind of cases. But you have to understand that the Salter-Harris fractures are generally examples of accidental injuries in children. But there are some others which are type of fractures that are also present, which may be related down not to the accidents, but it is actually related down to the abuse, which is actually called as the BBS. Okay, it is called as the BBS. Okay, which is actually called as the battered baby syndrome, or you can also call it as SBS, which is actually called as shaken baby syndrome. Okay, there are two types of conditions which also happens in children. Okay, there are two types of syndromes. One is called as the BBS, which is called as the battered baby syndrome, where the baby is beaten. Okay, or there is other thing that is involved down with also some other parts, particularly along with the skull. Okay, which is also called as the SBS, which is called as the shaken baby syndrome. Okay, how can I actually tell you about this one? Most of the times, actually, this may not be abuse. This may not be actually, beating up of the baby exactly. But sometimes, let me give you an example how it actually can happen. For example, to say, uh, you can be seeing down in where the families who have babies, generally the father or the mother will be holding the baby by their hand and trying to lift up in the air and try to turn around as a hula hoop, right? They will be turning round and round, right, while they are playing, while the mother is actually holding the hands of the baby and then try to lift up the baby in the air and try to turn around, right? So at that point of time, what actually happens that there will be displacements and there will be separation of the ossification centers from the bones. Did you understand the situation? When the baby is trying to hold by the hands and trying to turn around, right? Continuously turning around like a hula hoop. Yes or no? Uh, Let me see. Let me see. Just give me a second. Yeah, perfect. Okay, look at the picture. Look at the picture. You can understand, right? See, look at all the pictures. Can everybody hear me? Okay, okay, right. Just give me a second. Okay. Can you see the pictures or no? Just a second. So actually, when we are actually trying to do such kind of things to the baby, Actually, that is the one how it is actually happening, right? Okay, the first scenario is about the the father trying to carry the baby along with the hands, and the second picture actually when the father is throwing the baby out in the air, the baby's skull will be shaken, right? Okay, so if it is happening with much more younger kids, okay, if it is happening with much more younger kids, yes, there might be a problem that might be related down to the, you know, uh, the bones and their ossification centers because they will be under shear stress. Okay, the babies will be under shear stress. So, and that is the one that is actually likely to cause some type of a fracture that is related down to the ossification centers. That is one part of the story. Okay, this is actually, you can call it as abuse. But sometimes what actually happens is that some of the parents may be abusive to the children and they might be actually beating up the kids. Okay, so they might be actually beating up the kids where the kids might actually show up as the uh, you know occasional bruises, and other things, right? So babies actually might be abused and they might be uh, you know beaten very much and they will be shaken a lot. Okay, let actually see here when the father or the mother is trying to hold down the baby in his arms and trying to vigorously shake the baby. In the last picture I showed you, once you see here, that is actually called as the shaken baby syndrome, where the parts that will be involved is that there will be intracranial hemorrhages, particularly the subdural hemorrhages, and then there will be angle of the rib fractures, and there will be the displacement of the knee as well. Okay, so three parts are involved, which is actually the features of the shaken baby syndrome. Okay, if you can see the picture, you can actually try to understand what I'm talking about. So in the first scenario, where the father is trying to hold the hands of the baby and trying to see that there will be a shearing stress or the tension that is built upon the bones of the baby where they will be broken. In the second situation, where the baby will be shaken up heavily, and while trying to hold down the baby, let us say if the baby slipped, or let's say the baby father actually caught the baby in a different direction, maybe yes, that will be direct force or the direct injury to the bones involved. And the third one is actually also causing the shearing stress or the tension that is on the baby as well. And in the last situation, there will be when the baby is holded by the axilla and then actually shaken seriously, okay, a lot times when there will be the subdural hemorrhages along with the angle of the rib fractures and along with the knee fractures as well. So that is actually is a sign of, is a sign of battered baby syndrome or the shaken baby syndrome. You see here there will be multiple fractures. Okay, there will be multiple fractures that is related down to the babies. Well, it happens in almost every community. Okay, it is happening in almost every community. Not even a single community is being despaired of from this situation. Everybody is going to abuse their children at some point of time. But you see here, it might result in a lot of complications related down to the growth of the baby. So please never do not hit kids. Okay, kids are really very sensitive to trauma. Okay, and their bones are particularly very brittle. You have to remember one thing, that beating a kid, okay, forget about the beating, let alone beating. You have to never even verbally abuse a kid, even. Okay, you cannot shout at the kids. And you also have to understand, you have to cannot abuse physically or mentally to any person. Remember, you might be fighting out with your girlfriend, you might be fighting out with your wife, okay, all other people. You cannot mentally and physically abuse anybody, because the consequences or the ramifications we are going to take with that situation is really very difficult to deal with. For medical purposes, yes, they are difficult to deal, and there will be a lot of trauma that might be involved. and most of the people will be suffering from post-traumatic stress disorder as well. And if you are trying to build up yourself as a better individual and as a better doctor, do not abuse anybody. Okay, so right now it is particularly very important for doctors to know about the key radiographic features of a child abuse, particularly in all the communities. Yes, bipolar disorder or the maniac type of, or depressive mothers, okay, generally will have such kind of a problem. It will be seen mostly in the Western societies, but I believe it is present down in all the places. Everybody hits their child at some point of time. But child abuse is actually happening in much more severe situations. It is much happening in much more, reciprocated conditions where it will be repeated and repeated over time. Let us say you are something around like 10 years old baby, but you have been being mischievous, a lot mischievous. And yes, father hitting at that point of time, yes, it's okay, but it is not justified. Hitting the baby is not justified even there. But let us say the father is some kind of a very big bouncer. He's a big size guy, and the baby is really very small. And finally, if this bouncer is going to hit that baby, okay, who is something around like 200 pounds, is going to hit the baby who is just something around like 20 pounds or 30 pounds. So if he is being hit, what actually happens? Man, he is going to bounce out like you know, a football, right? So that is going to cause a lot of fractures. But however, even if you are even something like a big show guy, and then certainly you are even hitting some other big show guy as well. No, that doesn't actually make down any difference. It is going to be a same thing which is related down to manslaughter, right? I think you know what is manslaughter. Hitting other people is actually called as manslaughter. Okay, so don't get into a fight unless you know for sure that you are going to let that man down on the single shot itself. Okay, but most of the people we cannot do it because we are not Bruce Lee and Jackie Chan type kind guys, right? Even though that we have been learning Tai Chi Chuan and other things, well, we cannot do it that way. Okay, best way is that stay away from trouble. And babies cannot generally stay away from trouble, so most of the times, it is the responsibility of the doctor to evaluate and make sure that the baby is not abused. So how do we do it? You can see here there are a particular regions of the body where there will be signs of a child abuse that are present frequently. For example, to say distal femur and the humerus, ankle and the wrists, and where they will be having the metaphyseal corner fractures. Okay, there will be shaft fractures, there will be Salter-Harris fractures as well. Okay, Salter-Harris type 2 fractures as well. And you can also have to understand one thing, there will be multiple fractures in multiple regions, and the fractures will be at different stages of healing. Okay, I hit my baby today, let's say something like he had a femoral fracture. Then I hit again tomorrow on the hand, there will be another fracture, right? So different fractures at different times is actually a sign of a fracture abuse. Do you think that the baby can fall every day unless the baby is thrown out and from the balcony, right? Or unless that the baby is actually pushed away from the staircase? That's how it is happening, right? Was anybody being abused when they were a kid? If you were abused when you were a kid, this is the time you should wake up, and this is the time you should actually talk to your friends, and this is the time you should talk to your doctor. Okay, so was there anybody abused when you were a kid? Come out open and think about it. Okay, in Indian communities, this is actually considered as being disciplined, being strict, but no, it's not. It is not in our Indian tradition. It is not allowed according to the laws of the state that no child or no person can be handled physically. if you have been abused or if you have been abusing your kids, your friends, your partners, this is the time that those victims should come out and talk. So, has anybody been physically abused or mentally abused? If you need help, talk. I mean, not in the class, later, right? This is a very, very serious problem. Okay, on not only kids, even the big people, okay, adults can also undergo physical abuse. So as doctors, you need to be aware of physical abuse. All right, then the femur, humerus, and tibia are the ones that are generally are the fractures that are seen in 1 year children age. Like I said, yes, posterior ribs, avulsed spinous processes are the ones that are also seen naturally occurring less than 5 years of age. Multiple skull fractures when the baby is hit down on the head. Most of the times in Indian communities, they said that, okay, don't hit on the head, don't hit on the head, right? So why do actually they say that? It actually causes the fractures of the skull. Okay, so what is the thing that happens on the occipital bone? Have you ever been hit by your teacher on the occipital bone? I think you, everybody in the school going time, yes, you have actually have undergone situation by your teacher, right? Yes or no? Let us speak the truth. Can everybody hear me? Yes, most of the times, yes, your teacher has took out a big cane, your teacher has took out a big wooden scale and has hit you, right? They have hit you on your occipital bone as well. Actually, loss exist, but in Indian community, no, they don't follow. It might be happening because of religious practices. This is quite famous down seen along the missionary schools. Okay, it might be happening. Okay, I don't want to take the name of the religion here, but most of the cases of the child abuse actually comes down from the madrasas and the monasteries. Okay, where the Christian missionary schools and the madrasas are the people that are the one that are actually being abused a lot, right? So you should be actually able to know about those situations, but it doesn't necessarily mean that yes, all the people now even in every community is quite famous. So how do we actually find it? You see here, occipital bone fracture is one of the most common fracture that is involved here. And then you see here fractures of the appendant callus formation. Okay, repeated trauma is going to form repeated healings, and repeated healings is going to form repeated callus. So those is the one that is actually forming down the multiple fractures. Okay, then metacarpal and metatarsal fractures. I think yes, so many teachers actually try to hit on the knuckles, right? You will be taken down a you will be taken down you will be taken down a wooden scale and you will be hit on your knuckles. Okay, right? So I think yes, most of the times, I don't know about your places, but in my places, yes, my teacher has done this to me a lot of times. Okay, they has taken down a wooden scale and hit me on the knuckles. Okay, they have taken down a wooden scale and hit me on my humerus. They have taken a plastic tube and hit me on my tibia. Okay, yes, while I was a kid, yes, I have been abused by my teachers. So which actually, I could not tell. For God's grace, yes, I never had a fracture. But the situation is that most of the children will not be able to tell this one, right? Because all of these injuries are blunt force injuries. Blunt force injuries will not be visualized outside. The fractures will be hidden, and there will be microfractures, there will be stress related fractures, and they will be healing up slowly and slowly. So that's the reason a abused child may actually look physically normal as well. Okay, and then everything is completely fine. See, you see here one thing I told you before itself. I do not want to blame any religion, okay? And I do not want to blame any community here. So why are you making it a mess here? Umesh, I told you I'm not pointing it to any religion or not affording it to any person or any community. So why are you making it an issue? Ah, come on. So stop discussing it. All right. So you have to understand the child abuse is actually happening mostly in schools in the Asian communities in the form of disciplining, in the form of controlling the student. But in Western societies, it is happening because of the maniac mothers, depression mothers, schizophrenic mothers. Okay. And some people generally have a part of sadism. They just feel good when they hit the child. So, what do we actually do here? You see here, depending upon the type of abuse, the type of actors are seen here. Okay, so try to remember one simple hint when it is related down to the child abuse is that there will be multiple fractures in multiple regions, and particular regions are generally distal femur, distal humerus, metacarpal bones, fractures of the ribs, and the fractures of the femur. So those are the most important areas generally will be fractured a lot because those are the points of impact. Okay. And then you can see here there will be the metaphyseal corner fractures. Generally, when there are metaphyseal corner fractures, you have to understand that they are the small type of avulsion fractures which might be happening because of a rapid rotational ligamentous insertion. You see here, I'll tell you what exactly happens. How can we actually do it? When we were a kid, actually, my teacher used to take a pen, okay, and put it in between your fingers and then close your fingers tightly and then try to twist the pen. Do you know about this punishment? We call this as corporal punishment. Okay, remember this the scientific term for such thing is actually called as corporal punishment. Punishment given down to the body parts is called as corporal punishments, right? So did you understand? They will be taking down a pen, putting it down between your fingers, then close your fingers and then try to twist the pen, which will actually cause a shearing type of pain that is related down onto your ligamentous insertions of the phalanges, right? At that point of time, generally there will be the metaphyseal fractures. So that one is generally called as the bucket handle appearance. Okay. Then rib fractures. Sometimes rib fractures, when the children are getting down into fights, okay, bullying, you call it as physical bullying or mental bullying, bullying in the kids, okay. And I tell you, it can also happen in the universities, which is called as ragging. I bet your seniors in Delhi University could have done it, right? But I don't know, maybe somebody have not physically abused you guys, but still I think maybe yes there has been a situation of ragging. So why didn't you guys come up with a word like that? You see here, ragging, bullying, corporal punishments, all of these things, all of these things have to be not taken seriously. At the time when you have come down to the university, you were still kids. You were 17, 18 years. It means to say you are still teenage girls and boys, where your growth will be present down something around like, you know, till 25 years. So, if you have been abused, yes, that is the reason I'm telling. If you have been abused at any point of that time, this is the time that you should stand for it. This is the time that you should prove for it. And this is the time that you should actually work for it. That's the reason I'm actually talking this very seriously. Because it is the duty of a doctor to know about the child abuse. And other parts to observe here is actually the rib fractures. So there will be multiple rib fractures, and generally what are the ones that are present down here are the posterior rib fractures as well. And then the spinous processes of the vertebrae are also being broken down, right? And then the other thing is actually going to cause is the head injuries, which is actually called as the shaken baby syndrome. A baby's under the age of 2 years, where there will be the anterior fontanelle and the posterior fontanelle are not closed, they will be quite open. And what actually happens is that most of the times so many individuals are quite uh, amused by lifting up this baby and trying to shake down and try to play with the baby, and they are either intentionally or unintentionally trying to shake the baby. You see here, if the shake force is bigger and if it is frequent, it is more likely to cause the subdural and subarachnoid hemorrhage, and it causes cerebral contusions. Okay, so remember, subdural and subarachnoid hemorrhage and cerebral contusions are really, really very, very severe, which actually uh, you know has a situation which is called as the period of latency. Okay, period of latency. I think it is very, very common. Okay, it is very, very common in case of epidural and subdural hemorrhages. What is actually period of latency is that, let us say that there a baby or a adult. Okay, since we are talking about the babies, okay, we'll talk about the babies here. Let us say that the baby has a subdural hemorrhage. What actually happens is that during the first 5 minutes after abuse, the baby will go unconscious. Then, after some time, the baby will wake up, right? Then, immediately after a few minutes or a few minutes of time, what actually happens is that the baby is dead. And is such thing that is actually happening in between, where the baby went under comatose for the first few minutes and then actually awake, and then again the patient actually went down in complete coma or went down into complete death, is actually called as the period of latency. It is quite famous with hemorrhages, subdural hemorrhages. Okay, so which will also cause the seizures. Shaken baby syndrome and brain hemorrhages can actually cause seizures as well. So if a baby is complaining of seizures, if you are ruling out epilepsy, but if you are finding on evidence of cerebral hemorrhages, make sure that you are reporting it to the police, because this is or should be a case of shaken baby syndrome, and you cannot ignore it. I tell you one thing, in India, such cases do not get registered. That's the reason I'm telling you very, very repeatedly. In most of our Indian communities, we are afraid to talk against the parents. We are afraid, especially if it is a kid, especially if it is a female kid. Okay, right? We cannot actually talk against our parents. Not only about this, not only about you see here, not only about the physical abuse, but it is also about the sexual abuse as well. Okay, right? It is also about the sexual abuse as well. So you have to make sure that you know about the sexual abuse as well. Okay, right? If anybody has been abused in your childhood times, be it along with your friends, or be it along with your uncles or whoever, doesn't matter. Even if it's the woman or a man, doesn't matter. Even the men are likely to get raped. Even the men are likely to be get hit. Even the men are likely to cry. Men cry, men get raped, men also get hit. Not only women. Everybody is under sheer stress. So, if are the situations of sexual abuse as well, you should be trying to learn them. I don't know if your forensic teacher has actually taught you about this one as not, but they will be generally seen in a lot of you know, uh, low grade communities. Okay, it is quite famous in India. All right, it may not be present down in your family, it may not be present down in my family, but you have to understand, in a population of 100, 30 crores, yes, there are a lot of cases, there are a lot of kids that are actually not being shown up. Okay, physical abuse is quite famous in India. What about African countries? Benedict, Sandra, Novella, what about your countries? Is there physical abuse there as well? Yes. Right. Okay, they generally they call it as the corporal punishment in Bible. Okay, they call it as corpora, right? And okay, since we actually came down into the topic, I wanted to tell you there are about two particular things here. Okay, I think you know about the LGBT communities, right? Okay, which is quite famous in most of the African countries. Okay, yes, you know about LGBT communities, right? Yes. So in generally, forgetting about the LGBT communities, what actually happens is that if it is such kind of feelings, okay, you mean know for that they are not common in Africa, or know that you don't know what is LGBTs? Okay, I will message you what is LGBT later on, but still try to understand one thing here. It is actually related down to sexual perversions, okay? Sexual perversions. You can actually see here, I'll tell you actually what is the way that how a child abuse can actually start. Let me give you three clinical scenarios. What we actually see here that a let us say a mother, okay, it actually happens a lot. Okay, before I tell you all these things, I'm a doctor first, okay, and I'm not related to any community. I'm not related to any religion. So if I have been taking down any names of the religions, it is purely scientific knowledge purpose only. And I'm not blaming any religion here. So don't make a mess of this one, okay? That's my request. I tell you, generally, here there are certain verses in Bible actually talking about few things that it is talking about the baby who is actually the savior, right? Because Jesus Christ was the savior, and actually the mother is coming down into a delusion. Okay, the mother is coming down into a delusion that the baby that was born to her is actually the glimpse of a Satan. You get it? Okay, in certain Christian communities, okay, what actually happens is that the mother is actually thinks that the baby is the remnant of a Satan. Okay, it's not the Jesus who is born to her, but the Satan that was actually born to her. So that's the reason she is in a delusion. She will be suffering from schizophrenia, and she will start to hit the baby. Okay, so that is how it all starts. This one generally can happen. Okay, this one can generally happen because of the some of the rituals or some of the the traditions that are related down to the child birth. I think what we actually called as the baby showers. I think we know the baby showers, right? Do you do baby showers? I think. People who are know about the Christian communities actually know about the baby showers. Yeah, Umesh, we don't have such tradition. People who are in Christianity actually know about this. Actually, here the baby showers are generally done in after 21st day or something around like 65 days after the 65 days of the baby was born, right? So when there is actually the baby showers is going to happen, at that point of time, the mother is not actually trying to get this. And that is also the same period of time that the mother is actually going post, okay, partum depression. The mother is suffering from postpartum depression. Okay, so postpartum depression will be generally seen in almost around like 10% of the women. Okay, it is a very very serious disorder. That's the reason I'm talking about it. Okay, so 10 out of 100 mothers will actually have postpartum depression at some point of time. Okay, so during that depression episode, the mother is likely to abuse the baby. That's the reason I'm actually talking about the baby showers. So it is actually happening very, very severely in less than 2 years of age, because that's the time when you actually try to give the name to your baby. That's the same time when you try to actually give food to your baby. That's the same time when your baby will start an attachment to your mother or the father, right? Or to the starts with the physical bonding, right? Yes. So that one is actually happening down, which is actually happening because of a clinical condition called as the postpartum depression, right? So at that point of time, the mother actually is having delusional feelings and thinks that the baby born to her is a remnant or the glimpse of a Saturn. So she will start abusing the baby and she will try to kill the baby. It can be happening because of some other serious conditions also, but it is related to psychiatry as well. But there are some other things. Let's talk about some of the Indian communities here. Well, there are two clinical situations which you actually know as you should particularly remember them. Okay, you should know. I think you haven't heard of these terms, but okay. Look at this two terms. I think you haven't heard of these two terms, or you must have heard about this term as well. Okay. Have you heard about these two terms? The things are actually called as the electra complex and the Oedipus complex. Have you heard of these terms? Okay. Remember, remember, electra complex. Okay. Listen carefully. This is very important for your examination point of view. I mean, not radiology, but in the questions in forensics for Indian guys. Sexual perversions is a very, very important chapter. Okay, electrocomplex is a clinical situation. Okay, electrocomplex is a clinical situation where the daughter, will be having sexual desires towards the father. And ODPS complex is completely opposite to it, where the son is going to have sexual uh, urges or sexual desires towards the mother of the uh, mother mother. Okay, it generally will happen. You can actually see here. I think I have also talked about this before also. When you can actually see here that a 5-year old female kid is going to be more attached to her father, right? She will love her father, and the father is the best thing, the father is the best friend. But sometimes, in some individuals, it will actually take down as the age passes by, it will become a sexual orientation. When the child is actually going to get more bigger, she will be actually developing these sexual desires because of the attachment that she has developed with the father before. The same thing is actually going to happen with the baby, with the boy as well. So they are electra complex and oedipus complex. So this one is a form of sexual perversions in kids. Okay, so that's what actually I wanted to tell you. But on the other end, there are some things that are related down to a clinical condition called as the pedophilia. Okay, you know pedophilia, right? You know pedophilia. Pedophilia is to have a sexual desire towards kids. And then there will be two particular things that is actually called as the sodomy. Okay, a condition called as the sodomy. And there are certain things that is actually called as cunnilingus. Okay, cunnilingus. Okay, sodomy is to have a sexual intercourse to the anus, and cunnilingus is to actually try to put the sexual organs of a particular person in the mouth, where these people will be actually called as the active sodom. Okay, active sodom and a passive sodom. Okay, active sodom and the passive sodom. While I was actually talking about the LGBT communities, such kind of partnerships are quite famous in the LGBT communities. All right. For example, to say single same sex marriages, okay, for example, to say man to man, female to female, one person will actually try to be the husband, which is actually called as the active sodom. The other one will try to behave as a wife, which is actually called as the passive sodom. That is also going to happen in case of child also. The adult will be the active sodom and the kid will be actually the passive sodom. So if the baby is not actually trying to cooperate for that, the people who has have related down to the LGBT, perversions will have a corporal punishment as the corporal punishment as a form of justice to the relation. So there will be two conditions which is actually called as sadism and masochism. Okay, which is actually called as sadism and the masochism. So why I actually talk about all these things in child abuse is that because people, it is actually seen in certain parts of these people who are having such a kind of perversions related down to the physical abuse, related down to the sexual abuse, related down to the mental abuse. Actually, yes, it is seen in these communities. So that's the reason I actually wanted you to introduce to all of these terms. The situation is actually like this. Sadism is to have the sexual orgasm after inflicting the pain onto the other person, which means to say that you will have the sexual orgasm after you hit somebody. So, which is related down to the LGBT corporal punishment, which is actually also called as torture sex, which is also known as torture sex. So, this one is quite famous in pedophiles. Did you understand the thing? Why it is related down there? It is seen in pedophiles where the people will be abusing them because they are not cooperating during towards the sex, or or else they enjoy beating the kids and having sex with them. So that is what a particular form of pedophilia is. So that's the reason why actually they got it from there. And then masochism is actually having the sexual orgasm by actually let person be beaten. Okay, right? You can actually see in the LGBT communities, actually what happens is that the people will be, how can we actually say, people will be tied up with the handcuffs. People will be taken down as a dog and put down in a bone and finally being, so all such kind of torture will be actually called as the masochism. Okay, getting the sexual orgasm by letting me hit. So that is actually called as masochism. Sadism is by hitting other people. Masochism is let some other person hit you. So that is sadism and masochism. All of them might be related down to physical abuse during the childhood. and it can happen until you are adults. Did you get it? Why do we call it as child abuse? Even a teenager, okay, according to the world laws, who is a child? A person who is less than 18 years is actually called as a child. Did you understand now why I'm talking it as child abuse? It is for everybody. More than 18 years, you call it as an adult, okay? 13 to 15 years, you call it as an adolescent, okay, or a pubert. But before 13 years, we are actually going to call it as a child. So all the things less than 18 years is actually called as a child. And it can happen in anybody, and it can happen with anybody. And if you did not have such kind of a situation before, yes, you have a happy childhood. But not everybody is really blessed to have such things. And why? Actually, I wanted to talk about all those perversions before, just to actually say that there will be an evidence that is actually found on the radiography. You see here, in this fracture, you can actually see that there is a metaphyseal corner fractures and a small type of avulsion fractures of the distal part of the radius, which is a part of a child abuse. Then you see here there are rib fractures. Okay, there are rib fractures, and you see here on the left side the rib fracture is particularly healing stage. So that one, the sixth posterior rib is in the fracture. So that's the reason you call them as child abuse. So maybe he has hit on the chest. The baby might be hit on the chest because he has been frequently crying. The mother hit him because he has been frequently crying, right? And then there will be much more stress fractures as well, okay, which might be related down to numerous microfractures, which are repeated down to stretching and compressive forces. So in most of the individuals, they may appear normal, but still it is a common thing that is related down to the patient, that they complain pain for long standing durations. So that is actually related down to the stress fractures. Okay. So the main complaint is that the patient is going to complain the pain for a long period of time. Whenever your baby is talking about pain and pain and pain, make sure that he is not abused first. The second thing, make sure he is not having any kind of growth related problems. If a baby is complaining of pain, do not ignore it. Think about if it is related down to the joints, and if it is related down to the superficial surface areas. First, think about the physical abuse. Maybe your baby might be getting bullied. Maybe your baby might be getting hit and physically abused. So if it is happening that way, you have to take the action immediately. Well, in most of our communities, parents ignore it. Yes or no? Because maybe they think that the baby is lying, right? But in Western countries, no, they don't. Okay, they have got child rights. In Indian communities, I think you have known it. It is quite famous. Okay, no cases get registered. Childhood abuse cases are the least registered in our country. So did you understand why I actually talk about this much related to it? In my career, I have actually seen something around like three babies who actually had this kind of an abuse. One was a rape victim, okay, other was a physical abuse person, and third one was a corporal punishment given by a teacher. And as a doctor, yes, it was my responsibility to pass those people to the prosecution. So the police were involved. So that's the reason I'm talking about. You have to know. Yes, of course, in India. Of course, in India. It did not happen in your community or my community doesn't mean to say it doesn't exist. It exists. It exists a lot. It's just only that the child or the person involved is actually afraid to talk. The person is afraid to talk. That's the reason you think it is less, but no, it is there. Okay, I think if you haven't learned about psychology, if you haven't completed psychiatry, and you haven't completed psychiatric forensics, then I think maybe you don't know about the ramifications of these things. But no, believe me, it exists. It exists. Maybe go down to the Wikipedia page, child abuse in India. You will actually try to understand the statistics if they are high or low. Okay, but it may not be really very high as compared to the Western societies, but no, it exists. Right. Then stress fractures actually is a very different things which may not be related down to the physical abuse, but may be related down to the uh, overuse of the bones. Okay, so what actually happens is that there will be a dense zone of sclerosis and the bones appear thin, and zone of sclerosis along the medullary cavity. Okay, so these stress fractures are generally happening along the shafts of the long bones, generally along the proximal tibia and the fibula, or generally called as the March fractures. I think I have told you last time about this clinical situation. Second and third metatarsals are the ones generally are the one which is actually trying to form the foot pad. Okay, so they will be actually are undergoing a lot of stress when it is related down to the march, when you are marching. Okay, so they will be having appearance of a thin and a dense zone of sclerosis. Okay, and you see here there are few things. Okay, I need another something like 20 minutes, so shall we have a break and meet after 20 minutes, because I can complete this chapter. There are only simple fractures, only 4 or 5 fractures that are left. Is it okay? 20 minutes? Okay, let's have a break.